Hello friends, welcome to online pharmacology tutorials from Viral Academy. In this series of antiviral drugs, today we will talk about antihepatitis virus drugs. Hepatitis is the inflammation of the liver. It is caused by viral infection, adverse effects of drugs, alcohol and autoimmune disorder. Viral infection is the most common cause of hepatitis. In this tutorial, we will concentrate on hepatitis due to viral infection. There are 5 types of viral hepatitis. These are Hepatitis A, Hepatitis B, Hepatitis C, Hepatitis D and Hepatitis E. A different virus is responsible for each type of hepatitis. These 5 types of viruses belongs to 5 different families. The most common hepatitis are Hepatitis A, Hepatitis B and Hepatitis C. Let's look at Hepatitis A. Hepatitis A is an acute short-term disease. It is spread by consuming food or water contaminated by feces from a Hepatitis A infected person. Hepatitis A virus is an RNA virus, belongs to family Picorna virus. Vaccines are available to prevent hepatitis A. Treatment: generally, hepatitis A requires no treatment because it is an acute short-term disease. Hepatitis B. Hepatitis B can be acute or chronic. Hepatitis B virus integrates into host chromosomal DNA to establish permanent infection. Hepatitis B virus replicates in the host and assemble exclusively in hepatocytes. It is spread through contact with infectious body fluids such as blood, semen, vaginal secretions containing hepatitis B virus. Hepatitis B virus is a double-stranded RNA virus, belongs to family Hepatnaviridae. Hepatitis B is a leading cause of liver cancer. To prevent hepatitis B, vaccines are available. Treatment: acute hepatitis B doesn't require any specific treatment. Chronic hepatitis B can be treated with antiviral drugs. The treatment of chronic hepatitis B requires regular medical checkup and monitoring to check whether the virus is responding to the drugs or not. Anti-HBV drugs. Let's study adefovir dipivoxil as an example of anti-HBV drug. Adefovir dipivoxil is a cyclic nucleotide analog of AMP. AMP is adenosine monophosphate. It is nucleotide. Nucleotide means it contains a sugar, a phosphate group and a nitrogenous base. The nitrogenous base is adenine in this case. Adefovir dipivoxil is a product of adefovir. During the absorption, adefovir dipivoxil immediately gets converted into adefovir by the enzyme esterase, which is present in intestine and liver. The oral solubility of adefovir dipivoxil in terms of adefovir is about 60%. Adefovir is widely distributed to body tissues, mainly in kidney, liver and intestine. It is excreted through kidney. Mechanism of action of adefovir. Intracellularly, adefovir gets phosphorylated to adefovir diphosphate by the enzyme cellular kinase. Adefovir diphosphate competes with deoxyadenosine triphosphate for the enzyme HBV DNA polymerase. DNA polymerase is also known as reverse transcriptase. At this step, adenosine diphosphate competitively inhibit DNA polymerase. Also, it gets incorporated in HBV DNA, leading to the DNA chain termination and inhibition of HBV replication. Indications and doses for adefovir dipivoxil. Indications are chronic hepatitis B, including lamivudine resistant cases and those having concurrent HIV infection, patients with 12 years and older. Doses oral 10 mg per day. Duration of treatment is uncertain. Adverse effects are nephrotoxicity on chronic use and in patient with pre-existing renal insufficiency. GI effects like nausea, vomiting, diarrhea, flatulence, abdominal pain, pancreatitis, etc. Sore throat, headache, weakness, flu syndrome. Flu syndrome is a group of symptoms that is similar to those observed in influenza flu. Lactic acidosis, that is increased level of lactate in blood and decreased blood pH that leads to metabolic acidosis. Severe hepatomegaly with steatosis. Hepatomegaly, that is enlarged liver, and steatosis, that is the accumulation of fat in liver, that you can say fatty liver. Contraindications are renal problem and hypersensitivity. Drug interaction, it increases risk of nephrotoxicity with other nephrotoxic drugs. Brand names are Adefovir from Cipla and adefovir from Sun Pharma. 10 mg tablets are available. For further details of adefovir dipivoxil, please refer information provided by the manufacturer. Other important anti-HBV drugs are tenofovir, entecavir, interferon alfa 2A, lamivudine, and dipivoxil. The important details of these drugs, such as doses, adverse effects, interactions, and brand names, have been given in the notes. Friends, thank you very much for watching this tutorial video. Let's meet in the next tutorial video, which will be based on hepatitis C and its treatment. Thank you very much.